Okay, well, it looks like we're at the top of the hour. It's 12 o'clock and time for our 12 o'clock lunch and learn. Hopefully, everyone can hear me. I'm Renee Young with United Way of Greater Waterbury. Thank you so much for joining us for this lunch and learn on Medicare Open Enrollment. We are welcoming Kiara with us today. She is the regional coordinator for Shift Choices program at Western Connecticut Area Agency on Aging. So we're so excited that she's going to share some valuable information on key topics, including a brief introduction of Shift Choices, a brief overview of Medicare and its parts, and an explanation of Medicare Open Enrollment Period and what changes can be expected. So, Kiara, thank you so much for being with us today, and I turn everything over to you at this time.
Thank you, Renee. Thank you so much. Thank you, everybody, for joining us. As Renee said, my name is Kiara, and I am the Choices Regional Coordinator here at the Western Connecticut Area Agency on Aging. So happy to be here. Thank you to the United Way team for having me. And yeah, so let's dive in. I have a lot of information for you. So hopefully you can stay with us through the whole presentation. And if you have any questions, please feel free to put them on the chat. We would like to hold your questions at the end so we can answer them and continue with the presentation. So we can answer them at the end. Okay, so the Medicare Open Enrollment, it's actually now between October 15 to December 7. And let's see if I can pass the slides here. So SHIP is a national program. There are actually 54 SHIP grantees in United States. There's a SHIP program in every state. Puerto Rico, Guam, the District of Columbia, and the U.S. Virgin Islands, they all have the SHIP program. SHIP services are delivered by the state units on aging or the state Department of Insurance in partnership with the local area agencies on aging and other community-based partners. See. So there are 5 area agencies on agents in the state of Connecticut. We're one of them. We're actually number 5. If you see the map in your at your left, they're color coded. Each one is being handled by different area agency on agent. So we have the agency on agent of South Central, the North Central area agency on agent, the Senior Resources agency on agent, the Southwestern Connecticut area agency on agent, and the Western Connecticut, the area agency on agent that oversees 41 towns in the western part of Connecticut. That's number 5, and that's where I work or who am I representing right now. So SHIP program is, as I said, is a national program. So every state has the SHIP, but they call it differently. So in Florida, for example, the SHIP program is called SHINE. Connecticut decided to call it Choices, but it's essentially the same program. We're talking about State Health Insurance Assistance Program. It's a federal program. It's just called locally here Choices. So you might see it used interchangeably, but it's the same national program. So overall, the topic of Medicare health insurance is very, very complex, not just for our older adults, but for anybody. There are a lot of topics in the Medicare world, like decisions to make, things to consider, original Medicare versus Medicare Advantage, the parts of Medicare, the enrollment periods, the penalties, supplemental plans. All of that can be very confusing. And that's why we're here to kind of like help you navigate through all these options. And perhaps not to you directly, but if you know of someone who's struggling, who's turning 65, who's joining Medicare or about to join Medicare, so you can help alleviate that complexities and help them navigate through all this journey. Hopefully by the end of this presentation, you'll be able to answer some of their questions. But just know that we are here as a resource for you, and this is what we do. We do provide information in an unbiased, free, and confidential way. So all the information that we provide is completely unbiased. We don't endorse any insurance company. We don't represent a plan over the other or lean towards a plan recommend your plan. We basically tell you this is the options. These are the options available to you based on your health condition, based on your situation. This is what you have available, and then you make a decision. So that's our role here in our SHIP program. So just basic information. Medicare has, there are actually two ways on how to get Medicare coverage. The one way is original Medicare, which has the components of Part A and B. You can add a prescription drug plan, and then a supplemental plan can be added as well. The other option will be Medicare Advantage plan, which includes all of those parts, A, B, and D, all combined into one car. One plan will provide all those services. The original Medicare and Medicare Advantage, whichever you decide to choose, whichever option you decide to enroll in, you still need to get the Part A and B, your red, white, and blue card that has the Part A and B on it needs to be active, regardless of whatever option you decide to go, whether it's the original Medicare or Medicare Advantage option. Part A and B are managed by the federal government through the Social Security Administration. Okay. So what is the Medicare Open Enrollment Period and what can be done during this time frame? So it's a time frame for those already enrolling Medicare and original Medicare or Medicare Advantage with drug coverage, and for those who missed their initial enrollment period for Part D. The changes that you can make during this time frame is basically you can join a prescription drug plan, you can join a Medicare Advantage plan, or switch from one original Medicare prescription drug plan to another prescription drug plan, or switch between Advantage plans to another Advantage plan. Those are the options that can be done during this time frame. But just a keynote, we don't want to confuse the Medicare enrollment period with the Access Health CT enrollment period, which is November 1st to January 15th. Usually it happens almost at the same time, so people get confused. The Medicare Open Enrollment Period, it's October 15th to December 7th. That's the one that we are going to be talking about today. So why go through the process each year of the enrollment period? It's pretty simple. Basically, all the plans change the drugs they cover from year to year. So the drugs that used to be covered by your plan in 2024 might not necessarily be covered in 2025. Same thing with providers. The providers that you used to see for 10 years and that you are comfortable seeing might not be necessarily covered for 2025. And that could mean that you have to pay out of pocket for the services that you just receive from the provider, or change into a different one that can be much more affordable or under the network. It can also be, it's good to review the plans each year because contracts with pharmacies change from year to year. So they're not the same. Every year, the contracts are changing. There are always a potential to save money. So for those reasons and for more, it's better to look at your plans. This is the time frame that most individuals on Medicare have the option to check out the plans and make any decisions and changes without any penalties. And if sometimes they don't make changes and they have any surprises in 2025, some individuals are stuck with a plan for a whole year until the other yearly annual enrollment period in 2025. So we just recommend, even if you're happy with your plan, even with you're completely comfortable with the plan is covering everything, I don't have to pay anything, that doesn't necessarily mean that's going to be the same case in 2025. All we're asking you is to become informed, get familiarized with your plan, and see if there are any changes that are going to be affecting you, or if it continues to be the same plan that's going to work out for you in 2025, great. At least you make sure that's the case. So there are two important documents that you want to take a look at very thoroughly and make sure that you don't miss these documents in the mail. The one is called the Annual Notice of Change, and the other one is the Evidence of Coverage. These are normally mailed to you by late September. So, or in, normally you should have already received that from your plan, but it's basically telling you what's going to be changing in your plan. Saying, well, if you do nothing right now in 2025, this is what's going to happen. This is what you're going to be looking at regarding your plan. Are there going to be premiums? Are there going to be changes in your deductibles? Are there going to be changes in providers and things like that? Everything's going to be listed on that book. Usually it's a 1-inch thick book. So it's very important that you take a look at that document. And if you lost it or you haven't received it, you can contact the plan or you can contact us and we can help you give you that information as well. We also have that information available. The evidence of coverage. This is Medicare Advantage prescription drug plan and prescription drug plan costs and benefits that go into effect in January 1st, 2025. This document will list all of those benefits and normally they get sent out to you way in advance before 2025. So those documents you'll be looked out for in your mail. If you haven't already received them, you can contact your provider to request a copy of that. So what to consider when comparing Part D plans? Before making any changes, before making a decision to change Part D plans, switching to another Medicare Advantage plan, or switching from a regional to a Medicare Advantage, it's very important to consider possible scenarios. So for Part D plans, you want to make sure you ask yourself, does the plan cover all the medications I take? Are there any restrictions on my drugs like prior authorizations, step therapies, or quantity limits that I should be considering? How much will I pay for monthly premiums, deductibles, and the cost of each of my drugs? Is my pharmacy in the plan's preferred network? And if not, am I willing to change the pharmacy? Some people are very, they're so used to go to specific pharmacies and even if we tell them, well, if you go to this other pharmacy, it might be cheaper, you might be saving money. Yeah, but I receive better customer service on this one. So it's very important that all aspects are reviewed. What is the plan start rating? Can I fill my drugs via mail order? So those are some main questions that you want to ask yourself when you're changing or comparing Part D plans. And when you're comparing or changing Medicare Advantage plans before you make any changes, you want to take a look at the premium prices, deductibles, co-payments. What's the maximum out-of-pocket cost that I'm going to be looking at? What's the service area? The service area, does it cover the area where I live? Some plans are being, and what we're seeing in 2025, some plans are being removed from specific service area, and those individuals have to change plans. They might not receive, or they probably received. Usually, the plan will send you a notice telling you, well, in 2025, we're not longer going to be available in your zip code. You need to make a change, or you need to make a decision and make sure that you have insurance for 2025. So you can either contact the number in the letter, or you can contact us and we can help you find options since that plan is going to be moving away from your service area. Other questions are my healthcare providers and hospitals in the plan's network. So it is very important that you make sure that before hitting enroll, before having somebody enroll you in any plan, call your providers, call your doctors. Are they going to be accepting the new plan that you're going to be switching to? Because if it's a cardiologist that you've been seeing for 10 years and you're switching to another Advantage plan, and then all of a sudden in 2025 you present a new car, and well, we don't participate with that plan, and now you have to pay out of pocket every visit that you go with that cardiologist. So make sure that your network works with your plan. What are the rules that I have to follow to access healthcare services and medications? Again, prior authorizations, any step therapies, same thing. And does the plan cover additional benefits not covered by original Medicare that you need? Some of these benefits, additional benefits that are offered by Advantage plans could be transportation, could be dental, vision, hearing. You want to just, before you look at those benefits, not just look at the fact that you're getting, let's say, I get vision benefits. How much of that vision benefit are you getting in per year? Is it a $3,000 cap? Are there any restrictions? How can I use those $3,000 cap? Are they only going to be for lenses, for frames, for, yeah, all those questions should be asked to the provider, to the plan before enrolling. So in 2025 changes. So there are a couple changes that are taking place starting January 1st, 2025. And the main one is the Medicare prescription payment plan, which is pay out of pocket costs with installment payments, meaning that when you go to the pharmacy, you're not going to have to pay a amount when you pick up the prescriptions. You can opt in for these options, actually optional with the plan directly. It's only being done with the plan. Say, for example, I'm with Aetna and I'm going to pick up a prescription drug plan that is a prescription drug that is $400 and I don't have the money to pay. However, I can contact my Aetna plan and say I want to opt in for the prescription payment plan, which means that those $400 that I had to pay for this prescription is going to be spread out throughout the year, so evenly. So you don't have to pay anything at the pharmacy. You'll just get a bill from the plan to pay them monthly of this prescription. It's going to be all combined with your prescriptions. It's a monthly bill that you're going to get, and it's not going to reduce the price. It's just going to help you spread the cost through the whole year. So it's much more accessible, but it doesn't mean that's going to be deducting any price from the total amount of price that you owe for the prescriptions. Beneficiaries in Part D plans or Medicare Advantage with prescription drug coverage are eligible. Again, this is optional and you can opt in anytime between January 1st or anytime throughout the year. Who are likely to benefit from this payment plan? Those who are receiving high cost sharings early in the year. If you have a lot of prescriptions that are very costly, let's say specialty drugs or drugs that have high tiers and they're very expensive, this could be this can help you alleviate. Instead of paying the whole amount at once, you can spread it out through the year. The other change that's going to be happening in 2025 is a $2,000 cap on prescription drug cost, meaning once you hit the $2,000, you're not going to pay anything else. Again, that's going to be mostly everyone who has expensive drugs will see the difference, will see the alleviation on that cost saving. The last change is the Part D deductible that it's currently in 2024, sorry, it's $545. It went up to $590. That's depending on the plan you select. So some plans have different deductibles, but the amount cannot exceed $590 for 2025. So this chart will explain to you the differences between the Part D cap, the $2,000 cap, and the prescription payment plan. Does this reform lower my prescription medications? With the Part D cap, yes, it limits the amount you pay out of pocket, no more than $2,000 per year. With the payment prescription plan, no, it doesn't lower the prescription medications. It just spreads out the out-of-pocket drug payments through the calendar year. And who is eligible for the Part D cap? Anyone with a Part D plan through traditional Medicare or Medicare Advantage plan can participate, will automatically be eligible for the Part D cap. And for the prescription payment plan, anyone can enroll in. It is optional, and a lot of people might not be aware of this. So if you happen to know someone who is on Medicare, you might want to let them know that prescription payment plan is becoming an option to opt in, call the plan and opt in for 2025. What do beneficiaries need to do to get this benefit? For the Part D cap, there's nothing that needs to be done. The cap is automatic. For the prescription plan, again, you need to contact the plan and opt in. How will I pay my prescription medications? You will continue to pay through your pharmacy when you pick up your medications. For Medicare prescription payment plan, each month your plan will send you a bill with the amount that you owe. The payment is due every month, and it will explain to you how you can make the payment. All right. 2025 prescription drug plan changes. There are 16 party prescription drug plans in 2025. There will be 3 benchmark plans, which mean those who have Medicaid, the Medicare Savings Program. There are 3 plans they can choose from that will be $0. The only trick with them is that if you pick a $0 premium plan because you have low income, because you qualify, if you have Medicaid or the Medicare Savings Program, you want to make sure that's still the plan that's going to cover your prescriptions, because it doesn't really make sense to pick a plan that's $0 in a monthly basis, but none of your prescriptions will be covered, so that you're going to end up paying more. So always verifying that your prescriptions are going to be covered, and if they are, and they will be there will be $0 premium for the 3 benchmark plans. In 2025, the premiums will range between $12.40 to $190.80. The Blue Medicare RX Premier is the $190. The deductible, as mentioned, is going to be $590. And Clear Spring plans are currently sanctioned, so those are not going to be available in 2025. For Medicare Advantage plan, changes are that there are going to be 36 plans in 2025, 16 are PPOs, and 20 are HMO plans. 5 plans only offer Medicare Advantage medical services or coverage, while 31 of them are going to be including prescription coverage as well. So Medicare Advantage with prescription drug coverage. The monthly premium ranges between, again, $2 and up to $152. There will be 15 dual special need plans, and those are plans that are available only for those who have either QMB, the Medicare Savings Program, or Husky. Each plan will have its requirement. Some plans will say, well, we want the client to have Husky specifically, or we want the client to have either Husky or QMB, but the plan will specify which one is required. But there are going to be 15 of them in 2025. 2 of those are going to be only for people in institutions. 1 of them are only for individuals who have chronic disease, and 3 of them are going to be in selected counties. So how do I find the plan that fits all my needs? So we basically recommend that you create a Medicare account, Medicare.gov online account. This is the official governmental Medicare website. This website, Medicare.gov, has a tool. It's called Medicare Plan Finder, embedded on that website. The Plan Finder tool is what you can use to find the plans, to compare plans, shop around. It's basically like the market for Medicare. You can create a Medicare.gov account and then have a personalized access to it. You can enter your prescriptions, then compare plans side by side, see the options, see all the benefits, the contact details, and then you can either enroll in that website. You can either opt to do it on your own, or you can call us so we can help you navigate through the website. We can do the comparison, and we can do the enrollment on your behalf as well. Our number is listed here, but I'll mention it at the end as well. And the team, it's specialized to do this. You can also call 1-800-Medicare. So what do you need to create a Medicare.gov online account? You basically need your Medicare number, your zip code, the list of your drugs, your pharmacies, the list of your preferred pharmacies, and if you're receiving any assistance like Husky, Medicare Savings Program, am I on extra help? So that information will be needed for you to actually create a Medicare.gov online account. Create a username and password. It will ask you for a secret question, and then we can start doing the plan comparison. So now I want to move on to how to make Medicare overall much more affordable. There are three ways. One of them is through preventative services. Second one is through the Medicare Savings Program. And the third one is through the low income subsidy, extra help. So preventative services are benefits designated to keep you healthy and avoid illness, and include screenings, counseling, exams, shots, lab tests. For example, like cancer, cardiovascular disease, depression, diabetes, exams, all of those screenings will be covered by Medicare. There are the vaccines, the flu, the shingles, COVID, hepatitis B. If you're new to Medicare, within the first 12 months of starting with Part B, you can get a visit, not a physical, but you can get a visit and will be covered. Then there is the annual wellness visit. Again, not a physical, but it will also be covered as well. Those are considered preventive services. Services available to individuals with certain conditions or risk factors. For example, if you need basement measurements, alcohol misuse screening and counseling, diabetes screening and self-management training, hepatitis B vaccine, and other ones. So there's actually a CMS guide on that could list all your preventive services available, and you can contact us and we can help you by providing you a copy or helping you by letting you know where to find that guide. What is the Medicare Savings Program? It's just the second way on how to get Medicare much more affordable. It's a lot of people who are on this program get the Great Connect card, and it's a program. It's a federal program that is administered by the Department of Social Services. It's based on funds. So the program helps people with low to moderate income to pay for some or all of their Medicare cost. It will help you pay a lot of expenses regarding Medicare. Again, this is administered by DSS, but it's funded by the federal government. So each state has its own version of Medicaid, its own version of the Medicare Savings Program. In Connecticut, there are 3 different levels of the Medicare Savings Program. One of them is the QMB, which stands for Qualified Medicare Beneficiary. The second level is the ALMB, so it stands for Additional Low Income Medicare Beneficiary. And third one is the SLMB, which stands for Special Low Income Medicare Beneficiary. Each of these levels have different income guidelines that can give you different benefits. Bottom line, all of these levels will help you pay the Medicare Part B premium. In 2024, the Part B premium is $174.70, and that is being taken care of those who have the Great Card. The state of Connecticut will pay on their behalf for that Part B premium, and it's not going to get deducted out of their Social Security check. Only the QMB level, the first one, will pay the Part A and B cost shares and includes a Great Card, which protects them from improper billing. So people that are not eligible for Part A because whether they didn't work enough quarters, they don't have a work history, they can still get Part A's coverage and being covered or being paid by this QMB level. Only the QMB level will do that. And only the QMB level will provide you with the Great Card. The SLMB and the ALMB level, you will not have a Great Card for that. The gross income for all sources are counted, and assets are always excluded. So assets are not counted to qualify for any of these levels, only gross income. And that includes your Social Security, pensions, IRA, wages, all of that's counted. Wages is the only exception. Wages are going to be counted, but differently. The state of Connecticut has they have a calculation which they subtract the first $65 and then divide it by 2. That total amount is what's counted out of their wages to count towards the eligibility of the program. So if you're not sure and you want to know if you qualify for this program to benefit from, all so getting help with all the expenses that Medicare comes with, you can call us and we'll screen you to see if you qualify for it. All of the levels of the MSP, the QMB, the SLMB, or the ALMB will automatically enroll you in the low-income subsidy or extra help. So the low-income subsidy in 2025 reduces the co-pays for covered party drugs to no more than $12.15 for brand and $4.90 for generics. It pays the Medicare Part D deductible and it reduces your Part D premium. The Husky C LIS copays for 2025 will be $1.55 for generic and name brand $4.50. So that means if you have Husky C, this is how much you will pay at the pharmacy when picking up your prescriptions. No more than $4.50 if you're picking brand prescriptions. If you're on Husky C and receiving home and community-based services, you don't pay anything for your prescriptions. That's basically being taken care of. All right, so I just want to cover briefly the Access Health CT and Husky D. This is insurance for those not entitled to Medicare. So again, we don't want to confuse the Access Health Enrollment Period with the Medicare. Sometimes it overlaps. But beneficiaries on Husky D need to know that they must enroll in all pieces relevant to Medicare and should be screened for MSP or Husky C. The different Huskies have different income guidelines, asset guidelines. So it's important to screen them to see if they qualify. With the pandemic, many beneficiaries were automatically placed on the Medicare savings programs and some on Husky, even if they weren't eligible. But the public health emergency, as we know, it ended on May 2023. And some people are still undergoing through the process of redetermination, reevaluations, and sometimes they just say, well, I have Husky and it's covering everything I need. I don't need to enroll in Medicare. Well, I'm going to go into details a little bit later. It is important for you to know that they need to enroll on Medicare as soon as they become Medicare eligible, whether because they turn 65 or they have been receiving Social Security disability for 2 years. So there are different type of Huskies, and all of them have different income and asset guidelines. So the Husky A, as we know, it covers children, teens, relatives, caregivers, and pregnant women. The Husky B covers Children's Health Insurance Program for children and teens up to the age of 19. The Husky C is the Husky eligible or designated for those who are age 65 and older or those individuals with disabilities. The Husky D is for individuals up to the age of 64 without dependent children. Husky LB is an emergency Medicaid for those who have extreme conditions and they don't meet the immigration requirement or status. Okay. Husky C is part of Connecticut's Medicaid program. It's designated to provide healthcare coverage to specific groups of residents that covers adults age 65 and older, individuals with disabilities, or individuals who are blind. The services include doctor's visits, hospital stays, prescriptions, and long-term care support. It has both strict income and asset limits, which can vary depending on whether you're applying as an individual or as a couple. The program also provides assistance for nursing home care and home community-based services under Connecticut's Medicaid waiver programs. Again, the eligibility and financial threshold for Husky C are completely different from other Huskies programs. Just to continue with Husky, once someone is eligible for Medicare, the client will need to disenroll from Husky D as it will no longer provide coverage once Medicare takes over. Once they are Medicare age eligible or eligible for Medicare, they need to enroll in all parts of Medicare because the way it works is that Husky, even though it continues to be active and you got the letter that it's I'm going to be good for all this year. I'm on passive renewal. It means that I'm going to be good with Husky. But if you already turned 65 or you're already Medicare age eligible, Husky or the state of Connecticut will not pay anything, even if it says it's active, because they know Medicare is the primary insurance. You're supposed to be on Medicare first. So though it's always just to keep in mind, Husky is always the payer of last resort, meaning this is going to be the order that I want you to remember. Medicare will pay first, then the Medicare Savings Program or any medical policy if you have, if eligible. Husky C will pay third, covering the remaining cost. So that's the order: Medicare first, then the gray card or the supplemental card, then Husky C if there's still any items or services that are not being covered. Husky C covers several services that Medicare doesn't fully cover or provides more comprehensive assistance for. Some of these include the long-term care nursing home, and thus Husky C covers long-term care, whereas Medicare only covers short-term rehab. Home and community-based services, including PCA, homemaker, respite services to help individuals stay home and rather than enter to a facility. Dental care, hearing aids, and eyeglasses, these are typically covered under Husky C. While Medicare generally does not cover them, some Medicare Advantage may include these benefits, but they have a limit in scope. So medical transportation and non-emergency transportation to medical appointments, which Medicare generally doesn't cover, some Medicare Advantage plans may offer limited transportation benefits. Same thing with prescription copays. It will help you with costs not covered by Medicare Part D, especially for dual eligible clients. So combining both Husky C and Medicare will help enhance the coverage and will fill in the gaps for a lot of the benefits needed or the coverage needed. But Husky C alone will not be the primary payer if the client is eligible for Medicare. They will not pay anything as long as Medicare pays first. So that's basically what I have for Medicare. I also wanted to point out that program is mostly based on volunteering. If you're interested in providing information to older adults and help them navigate the Medicare world, you can call us and we can help you with the training process, give you some information. There are a lot of ways that you can volunteer in our program. You can become the trusted person or the to-go person in your community when it comes to Medicare. You can assist customers in resolving complex issues. Again, we're not brokers. We don't represent private insurance. Our information and our service is not based on commissions. We just basically help individuals navigate the insurance, Medicare, Medicaid, and other services and programs that are available to them that can help them save money. If you're interested in joining our program, our volunteer program, please call us and I can help you get started on that. Some of the resources that we have or that is available for Medicare, you have the Medicare and U-Book. The 2025 is already out and being distributed. Medicare.gov official website, the SHIP website, which is the State Health Insurance Assistance Program, and our agency on agent, one of the area's agency on agents that I represent to. And you can call us. We have a team of certified choices counselor that can help answer questions live. These are the websites and phone numbers of important key contacts like Social Security Administration, Centers for Medicare Advocacy, Medicare Interactive, and National Council on Aging. This is our phone number. Phone number is the local 203-757-5449, extension or option 4, or the hotline 1-800-994-9422. And with that, I would like to open the floor for any questions that you may have. I'm not sure if you guys have any questions. You can raise your hand or unmute yourself if you have any questions. Kelly, I'm gonna unmute you. I don't have the functionality to unmute you. Maybe you can.
Yeah, people should be able to unmute themselves, but let me see if I can, if she's having a problem.
It says that it won't let her. You can type your question. I'm sorry. You can type your question and I can, yes, and I can answer. Can you please let me know the link to the reporting website? I've done 3 so far and I want to practice it. Yes, so people who are already certified choices counselors, they do have a reporting database. We report this information that we help individuals with Medicare to the ACL, which is the federal government. They want to know if our program is helping individuals, is if we're doing what the program is intended to do. So to access the STARS database, once we complete the process of the documents that you send, I will enable your access to the STARS, and I'll get back to you on that. But that's basically on my end. I have to manually go in and give you access to that. But yes, I will work on that. Does anybody else have any other questions? Hey. Well, if you have any other questions, I know I'm going to be sharing the slides with Renee, and then
Yes.
maybe you can share to the team. And this information it's for you guys to help individuals navigate Medicare. And if you want to share it with other individuals, feel free to do that. And reminder, just we're here as a resource. Call us, and we will be able to help you answer any questions you may have, either email or phone call, whatever works.
Kiara, thank you so much. What a plethora of information you are able to share today to help people navigate this system or to provide that assistance to someone who needs it. Thank you so much. I can't imagine being able to navigate all of this. It is a lot. So thank you. We will definitely share the link as well as your presentation with everyone that signed up so that you can also share if you know of anyone that was not able to make it this afternoon. So thanks,
Sounds good.
everyone.